Good day, everyone. In today's session, we're going to discuss a topic called Reactive Neuromuscular Training. In short, let's call it as RNT. So, this is one of the advanced techniques in physiotherapy. Normally, this technique is being used in sports rehabilitation, but I would think that this technique also could be used in musculoskeletal rehabilitation. So let's see the objective of this topic. At the end of the session, you will be able to understand the concepts of RNT. So RNT consists of some physiological and neurophysiological concepts. So we are going to discuss in brief about the concept because RNT has the vast uh, concepts in it. We're going to discuss in brief about that. And we're also going to discuss on the concepts of proprioception because the main theme of RNT is to rehabilitate or re-educate the proprioceptors. Okay. Then we also going to see the pathophysiology of joint injuries. And finally, we're going to see a basic or brief things about the rehabilitation perspectives of RNT. Let's start with an introduction. So, this technique, RNT, the concept of RNT, was originally proposed by White in the year 1990. So, such a golden technique. So, the RNT program is umbrella heading for varieties of rehabilitation techniques designed to restore dynamic stability and fine motor control. So, there are two purposes of this technique. One is to restore the dynamic stability and to restore the fine motor control. Normally, after the joint injuries, so these two variables cannot be restored properly. So RNT is helping, extending the help to restore the dynamic stability as well as fine motor control. RNT techniques are intended to augment traditional rehabilitation in a complementary fashion via proprioceptive and balance training in order to promote functional return to activity. Actually, the RNT is an augmented technique. Augmented means this can be incorporated as an additional technique. This is not a primary technique. So normally if you are using any conventional approach of physiotherapy rehabilitation, so RNT could be incorporated additionally or along with that. So this technique cannot be used as the primary technique of rehabilitation. So the main objective of RNT program is to facilitate unconscious process of interpreting and integrating the peripheral sensation received by the CNS. Normally, if you are doing any activity in day-to-day basis, that activity would be restored in your brain in the unconscious area. So these activities you cannot forget it easily. So through the RNT program, so this process, this unconscious process could be facilitated further. Normally, after the injury, this unconscious process will be damaged by using the RNT technique. This unconscious process will be restored again. Okay. Let's see the physiology of proprioception. So, proprioception is one of the type of receptor. So, proprioception is a specialized variation of the sensory modality of touch that encompasses the sensation of the joint movement and joint position. So there are two senses it is being perceived. One is the joint position, various positions of the joint, and also the movement. Okay, in any direction, the movement is being performed. That is being sensed by the proprioceptor. Actually, proprioceptor is a kind of mechanoreceptors. Okay, so information about the position and movement of the joint is available from the peripheral receptors located around the articular structure. So this specialized receptor is being located in and around the joint. It's not only located in the articular areas, also the extra articular areas. So these specialized receptors provide the information to the CNS regarding the joint position change and about the movement. So these mechanoreceptors do this by converting the mechanical deformation of electrical impulses that are sent to the CNS. So proprioceptor is a kind of mechanoreceptor. So there are many varieties of mechanoreceptors are there. Proprioceptor is one of the type of receptor. So the main function of it to sense about the joint position and about the joint movement. So what about the pathophysiology of joint injury? Normally, if any joint is get injured, so we may think of what structure was involved. Example, I would say ligament injuries or meniscus injuries, or sometimes the bone injuries or cartilage injuries. So these are all the things normally we look for. But we are unaware that in any joint injuries, the proprioceptors also would be involved. In most of the rehabilitation we are planning, we are ignoring that. We are ignoring that. So through the learning of this technique, we could understand that the proprioceptors will be involved in any type of joint injury, whether it could be a type of traumatic or non-traumatic. So we need to take some measures or effort to restore this proprioceptive function. Okay. So following the traumatic subluxation or dislocation or an atraumatic instability of the joint or disruption to the articular mechanoreceptors that inhibits the normal neuromuscular reflex joint stabilization. Joint stabilization is one of the important parameters. So that is being maintained by the reflex mechanism. So in case of injury present in the proprioceptors, this reflex mechanism will be damaged or it been how do I say it is been malfunction. So, by using the RNT technique, this reflexive mechanism could be restored properly. This partial deformation results in proprioceptive deficit, which contributes to repetitive injuries and progressive decline of the joint. So, in case if this neural pathway is being deficited, so what happens? It leads to further injuries or repetitive injuries. We also call it as the recurrence. Okay, so by using the RNT technique, we are not only restoring the dynamic stability and fine motor control, also we are preventing the recurrence of injury. That is also a part of rehabilitation. Because if you are planning for the rehabilitation for any purpose to restore the function or restore the structure to the normal function, so we also need to look for the prevention of injuries or prevention of recurrence. So RNT is useful for that. Motor programs are adapted to receive specific sensory feedback for accurate execution of various motor tasks. For any motor task execution, that there is a need of the sensory input. So this sensory input could be given by many structures. Proprioceptor is one of them. So if the proprioceptive impulses is not in a proper way or if it has been affected by anything, so the motor execution also affected accordingly. The injury causes sensory feedback which does not fit the existing motor program, causing errors in the normal and coordinated patterns of muscle and functional joint stability. So by that, what happened? The normal joint stability as well as the muscular function in the affected area will be affected. So ultimately, the individual will be unable to resume the high level of activities despite achieving the clinical goals. So clinical goals, which we are meaning of pain reduction or functional restoration, all would be happen. But so after some period of time, there is a chance of recurrence. There is a chance of recurrence, or sometimes the patient couldn't be able to resume with a high level of function. Okay, high level of function because of the loss of proprioceptors. So by using the RNT, these loopholes could be satisfied. Okay. Recognizing the deformation of injured and unstable joint is now only half of the battle. So how injury was happened, okay, and by that what all the consequences would be happen. Okay, understanding the things is one of the only half of the battle, but the remaining things are what, how to rehabilitate that, how to restore that in a near normal or to the near normal state. That is the remaining part of the battle. The rehabilitation specialist must design a program that re-establishes the dynamic stability of the joint in hopes of returning the athlete back to the competition. So what we have to do as a physiotherapist, we have to make a separate plan of program. So by that, how we can restore the function of proprioceptors. Okay, by that, how we can restore the dynamic stability as well as fine motor control. So along with that, we are also planning the prevention of recurrence. So for every patient, we have to come up with this plan. Okay, there is no standardized protocol or something on there. So we have to make this plan for every patient based on their level of injury. Reactive neuromuscular training is employed as a part of the functional exercise progression and can be instituted during and following the achievement of clinical based goals. So once the patient has been achieved the short-term goals or the minimal expectations like pain reduction and ADL, return of ADL and all those things, then we can incorporate the RNT. The best place to incorporate the RNT at the terminal phase of the rehabilitation. The terminal phase, which I'm meaning, is at the end part of the rehabilitation. Normally, if you are planning the rehabilitation duration for 3 months, means at the last month, maybe at the third month, we can plan to incorporate the RNT. Okay, why? Because when you are incorporating the RNT, so when you are training the patients by using the concept of RNT, sometimes it could lead to fatigue. So that's the reason this technique cannot be incorporated at the early phase of the rehabilitation. Okay, so better to have at the terminal phase of the rehabilitation. So before the clinician can utilize these activities, he or she must understand the possible effect of RNT has on the CNS. Okay, so before we are using this technique, so as a physiotherapist, we should know how this technique is working. Okay, how we can, okay, so correct this deaffirmation things. Okay, how properly we can use the proprioceptors to tune it. Okay, how we can prevent the uh, recurrence, and also how we can brought back the dynamic stability as well as the fine motor thing. So that we have to understand it properly. This is one of the effort, the initial effort to make you people aware of RNT and why the RNT is needed in the rehabilitation strategies. Okay. Let's come to the rehabilitation strategies. Actually, this is one of the tentative plan. This cannot be used for all the patients. Depends on the patient type of injuries. We have to modify this plan. This is one of the tentative plan. So we can under this rehabilitation we can divide the incorporation of RNT into 3 stages. So we can extend it accordingly or we can minimize it accordingly. The phase one is the static stabilization. Phase two is the transitional stabilization. The phase three is dynamic stabilization. So this phase we could use it for the incorporation of RNT at the terminal phase of the rehabilitation. So in the phase one, what we supposed to do, we can use isometric exercises. So we know that isometric exercises is one of the powerful techniques, okay, because the motor firing will be more when we compare with the isotonic technique, isotonic exercises. So first we can start with the isometric. So there are some variants we could use it like the oscillated technique of isometric stabilization, shortly known as ITES, or impulsive technique of isometric stabilization, ITES. So these are of variants in isometric exercises we could use. So at this stage, we are using only isometric form of exercises. So by that, we can we don't have chance to aggravate the injuries. At the same time, the muscles could be strengthened. Okay, so that is the main goal of using the isometric exercise in the first phase of the RNT. The next one is the transitional stabilization. In this stage, what we are doing, we are converting the isometric into isotonic. So normally, when we are using the isotonic, we could use in either in concentric form or eccentric form of exercises. Okay, to progressing through the full range of motion. So the main goal of using the or transferring the isometric to isotonic is to progress from the unweighted to weight. So in isometric, we were use only the minimal okay, amount of force, okay, or minimal amount of force. But in isotonic, we are increasing the threshold of exercise. The principle of overloading, the concept of overloading, we are using this. Okay. The last phase is known as dynamic stabilization. Okay, so in this stage, what we are doing, again, we are increasing the threshold furthermore. So we can use some ballistic form of exercises like reduce stretch shortening cycles like plyometric exercises, any other dynamic training we could use it. This dynamic training can be the occupation focus or depends on the patient's needs. We can modify it accordingly. But the theme is what? So the threshold of the exercise need to be progressed. Okay. So that is the idea behind the rehabilitation using the RNT concept. Okay, so in this session, I could be able to discuss only in brief of the RNT concept and rehabilitation session because RNT is such a vast technique. Maybe in the upcoming sessions, we will discuss in detail, and if possible, we will also having some demonstration sessions to do some videos. Okay. So we also conduct a research on using this technique on the patients with overhead posture. Okay, especially in higher learning situations, we found that actually we compared with the conventional physiotherapy approaches. So along with the augmented RNT, so we found that okay RNT patients had better recovery when we compare with the conventional approach of physiotherapy. So these are the references, and thank you for this opportunity.